Good evening, one and all. On behalf of Dr. Agarwal's Institute of Optometry, I'm very happy to welcome you all once again for the 7th episode of our Optometry series. The topic for today is selection, fitting, and assessment of multifocal contact lenses. We have a very good moderator for today. We're very proud to have you, Mr. Dr. Nirav Mehta. Thank you for joining us, sir.
Yeah, thank you, Maheshwari ma'am, and all the team for inviting me as a moderator. Thank you so much.
I also welcome Maheshwari ma'am and Jemima ma'am. Maheshwari ma'am, HOD of Innovations at our college, and Jemima ma'am, program head for the internship. Hi ma'am, thank you for joining us today, ma'am.
Yeah. Thank you, Gomati. So I would say a few words and I will go to, I have another meeting as we have been telling. So I'm very, very happy that Nirav has joined today. So as I know him as a contact lens educator and associated with IRCL, I've been watching him and no, I could see that every year you can hear some news from Nirav. He's got this award, he's got that award. So he is, in some WhatsApp group, he will be. So he is an achiever and very proud moment that we have that he is able to join with us today. And we are having a very important topic that is multifocal contact lenses. Though we all study the theory of it, most of us don't practice this. So I wish all the best for this session today. Thank you, Nirav, for joining once again, and we'll be catching up later. Thank you.
Thank you so much, ma'am.
Thank you so much, ma'am. Thank you, sir, once again for joining us amongst your busy schedule, sir. Now I call Ms. Nitisha to welcome the moderator. Hi, Nitisha.
Good evening, ma'am. Hello, respected officials. Very good afternoon to all the excellences. I'm Nitisha, pursuing my B Optum in Dr. Agarwal's Institute of Optometry, Chennai. A warm welcome to the 7th episode of Optometry series. Thank you for taking the time to join us today as we are talking about the selection, fitting, and assessment of multifocal contact lenses. I would like to introduce you all our Honorable and Consigntious Moderator, Dr. Nirav Mehta, Principal of Harijot College of Optometry and Rotary Eye Institute of Navshri. Sir completed his bachelor's and master's from Bharati Vidyapeeth University and Pune in 2007 and 2009. Sir has recently completed his PhD from Veer Narmad South Gujarat University, Surat. Dr. Nirav Mehta received prestigious fellowships such as Fellow of American Academy of Optometry and Fellow of Contact Lens Education. Sir is an associate member of College of Visual Development, COVD. Sir had also presented many papers and received awards such as Best Faculty Award, Best Educator Award, and Best Optometrist of the Year Award from Optometry Council of India. Welcome, sir. I hereby welcome today's speaker, Ms. Priya from 3rd year, pursuing B Optum in Dr. Agarwal's Institute of Optometry. Since everyone is here, let's get started. Ms. Priya, kindly start your presentation.
Ma'am, screen workout.
No, da.
Now.
Yes. Proceed, Priya.
Good evening, everyone. I am Priya, pursuing 3rd year B Optum. Today, I am going to talk to you about multifocal contact lenses. Introduction. With an aging population, the number of presbyopic patients who require vision correction is increasing. It is estimated that there will be approximately 2.1 billion presbyopes worldwide by 2030. For normal individuals, the image is focused on the retina. But for presbyopes, the lens hardens and unable to change shape. So the image forms behind the retina. With the help of plus lenses, presbyopia is corrected and the images fall on the retina. What is presbyopia? As presbyopia is derived from ancient Greek translated into Latin, presbys, old man, and ops, eye, or to see-like. Presbyopia is a visual condition which occurs when the eye no longer has sufficient focusing power, accommodation to bring near object into clear focus. Due to the normal process of aging, the crystalline lens loses its flexibility and can no longer permit the required change in the shape becomes blurred. The problems by the presbyopes. What they want: normal life without age reminder, youthful and confidence, free and flexible life using devices, reading papers, going for a walk, doing sports, etc. What are the treatment options for presbyopia? Spectacles, we can give bifocals or progressives. In contact lenses, we have monovision. Nothing but dominant eye will be corrected for distance and non-dominant eye will be corrected for near. And multifocal contact lens. We will see in detail about multifocal contact lens in further slides. And separate glasses for distance and near. Distance contact lens and near reading glasses. Corrective options in contact lenses. A study was conducted in UK between 2014 to 2016 showed 1/9 of presbyopic patients used contact lens as their main form of vision correction. Out of 529 presbyopes surveyed, only 57 were contact lens wearers. Mostly distance contact lens and near vision glasses is seen, but the use of multifocal contact lens is also drastically increased over years. They help not only for presbyopia, but children have also showed significantly slowed myopia progression with statistically significant differences between the two treatment options after 6 months period. Data collected on 2017 with the use of multifocal contact lenses shown. Multifocal contact lenses. In multifocal contact lenses, we have near, intermediate, and distance zone. Mostly, the near vision is given in the center, followed by intermediate and distance. Types of multifocal contact lenses. Multifocal contact lenses is classified into two types: simultaneous design and alternating or translating design. In simultaneous design, we have concentric, diffraction, and aspherics. Segmented translating design. In segmented translating design, distance power is in the center and upper zone, near power is below, bottom edge is flattened to keep the lens from rotating. And in simultaneous design, we have concentric, aspheric, and diffractive design. Concentric design is divided into two: D lens and N lens. In D lens, the distance vision is given in the center zone and followed by intermediate and near vision. In N lens, the near vision is given in the center zone followed by intermediate and distance vision. Who are suitable for multifocal contact lens? Presbyopic patients, cosmetical appearance, cylindrical power with less than 0.75 diopter, occasional use, pupil size of up to 4 mm, and myopic kids. Who is not suitable? All the contraindication of contact lens wear will account as same. High astigmatism, 0.75 diopter to 1 diopter of astigmatism. Non-toric multifocal contact lens can be given, and for greater levels of astigmatism, toric multifocal contact lens can be given. Larger pupil size, dry eye, infections, corneal abnormality, seasonal allergies, systemic conditions like diabetes, hypertension, collagen vascular diseases, systemic diseases are not suitable for giving multifocal contact lens. Fitting multifocals of contact lenses. Preliminary assessments to be made: history, vision and refraction, keratometry, horizontal visible iris diameter, pupil size, PFT, eyelid tension, dry eye assessment, and finding dominant eye. In history, we will ask about occupational visual needs or other needs, experience with contact lens, reasons for wearing contact lens wear if applicable, At which distance or distances clear vision is most crucial, hobbies, lifestyle requirements, general and ocular medical history, medication use, and allergies. Selection of lens. We need to select the lens by base curve selection, power of the lens, and add selection. If it is less than or equal to 1.50 diopter, low add should be given. If it is greater than 1.5 diopter, it is called as high add. Patient consideration starts with consideration of patient's need. Eventual success of multifocal contact lens depends on the patient and their motivation to try these lenses, and on the ability of the clinician to translate the available information, be it clinical prescription or pupil size, or patient-related visual needs of each patient. Applies for presbyopes who spend significant time in front of computer screens or performing near tasks. Vital component of multifocal contact lens fitting: dominant eye, distance-friendly prescription, and in non-dominant eye, near prescriptions. Contact lens usage reasons for dropouts. Like young adults, old people also wear contact lens. Why do patients drop out after 40? The reasons are the same as they say before 40 also. It is comfortable issues, convenience, better vision, safe and less expensive, and etc. So fitting plays a major role in multifocal contact lens. We select lenses based on K reading, refraction values, and HVID. Generally, spherical power, cylindrical power, axis, and add is mentioned as low add or high add, and base curve and diameter is given by universal base curve and diameter values. If we need any alterations, we can need it. Lens centration and movement. Centration and movement is important when fitting multifocal contact lens designs. Lenses that are decentered or that move a lot during eye movements or blinking are likely to negatively affect a patient's success with multifocal contact lens. Adaptation time. Allowing lenses to stabilize for 15 to 20 minutes prior to lens fit assessment and performing an over-refraction. Asking the patient to perform real-life tasks. Set appropriate expectations, reminding patients to get used to their new lenses. Following up after 14 days to evaluate initial lens wear satisfaction and any problems. Clinicians should not hesitate to make a prescription change if their patient is not quite convinced but motivated to continue trying. Good things take time. Troubleshoot. If the patient has distance vision problem, changes should be done in dominant eye. First change, add minus 0.25 to the prescription. Second change from high add to low add. If the patient has near vision problem, changes should be done in non-dominant eye. Change 1, add plus 0.25 to the prescription. Change 2, change from low add to high add. Example 1. If a patient has 0.25 diopters pure in right eye and with dominant as right eye and minus 3.50 in left eye with high add, the patient complains that the distance vision is not clear. Add minus 2.5 diopter in the dominant eye. If the problem is resolved, there is no need to change the add. Example 2. If the patient has 0.25 diopters pure in the right eye and right eye is dominant and minus 3.50 in the left eye with low add, the patient complains near vision is not clear. Add plus 0.25 in dominant eye. Still, if the patient says he is not convinced with the power, try adding plus 0.25 in dominant eye also. If problem is solved, no need to change the add. If the problem still persists, change the add from low to high. Recent advancements in multifocal contact lenses. Modifications of annular or aspheric designs are now entering the market. One example is the recently introduced monthly replacement aspheric multifocal contact lens design that employs a decentered near ad zoom. This lens design is intended for patients with smaller pupil size or older presbyopes, who are often found to have smaller pupils. In this design, the distance zone is in front of the pupil, while the near zone is decentered inferior nasally in order to align with the naturally occurring convergence of the pupil during the near task. These are my reference. Thank you.
Thank you, Priya. It was a very nice, elaborative presentation. Sir, I would request you to give your inputs now, sir.
Yeah, so Priya, congratulations first that you are presenting live on YouTube, and that's really a good initiative by Nagrawala Institute. I think that's definitely help you all to get into presentation way of presenting it. Coming to your presentation, yes, the topic is good and you have taken a lot of higher.
Sir, just a minute, sir. Sorry to intervene. Participants and audience, if you have any questions, do post it in the chat box, be it Zoom or YouTube. You post it, we'll ask the sir and we'll ask sir to answer later the session.
Yeah, so the topic which you have covered, which was very good, I think the main perspective on multifocal contact lenses, which is how to fit and what is there. And what I would look into the aspect of multifocal contact lenses, the major areas which we should look into it. The first is the patient's age and the history of the patient, whether how the patient is ready for contact lens and whether the patient should be thinking that yes, contact lens is something going to be important in their life. Coming to this point, we are listening to a lot of times about the proactive recommendations. I think, but that's the one area which most of us miss during the counseling. Like we don't recommend multifocal contact lens, and we think that the contact lens is taken by the patient. So the first step I would look into it, like first, at least we should share our inputs that you are an eligible candidate. You can go for a multifocal contact lens. So there is one option which is called multifocal contact lens. If not, then you can think of a monovision as well, irrespective if they are ready to remove glasses or they don't want to go any other areas. So that is one aspect. So I would first point is my perspective would be on recommendation. That's the main area which we should look into it. Second thing is we really need to look about the consensus, how the patient is ready and what is there in their eyes. Like one is the major aspect. She mentioned about that point, the investigative approach. But when it comes to multifocal, where we may just do the normal routine investigation, we forget it, which is, but the more important aspect we should look is the pupil, because your major concern is the pupil, how the pupil is there. If the pupil is working, reacting to light, and whether the lights will be proper. If the pupil is not the irregular one, if it is not in proper shape, then possibility the multifocal contact lens may not be a good choice. So pupil we should look at very thoroughly and to identify how they are being able to wear. This is the second most important point I would look into it. And another is the third, which we look at is the assessment. Like we are going to deal with the cases more than 40 plus. So probably they are having some dry assessment and dry eye changes. So we need to look all those aspects of dryness and related to systemic illness. That is also a concern, and probably our role to give them a lens along with them a solutions. It's not like a person should wear it continuously for 12 or 15 hours. You can always recommend them as per your need and as per the patient's need. This is the another aspect. The last and the most important aspect, as a student, we never think, I guess this is one area we all can think into it. The most important aspect, we know theory, we know probably understanding about multifocal lenses and designs, but when it comes to practice management, we really don't know which lens we can give to them or what modality we should give into these patients. So first and foremost, we should find out the availability of the lens. What are the available options is present in our Indian scenario and Indian context. Second, we should look at about the important aspect, how many lenses we get it into the lens pack. Because if we are not aware about that, one product is having a 30 lens pack, another product is having 6 lens pack. And that's something which is very, very important. So we should look that aspect as well. So if you are not aware about any products, I'm not saying that one product or not recommending particular brand of products, but we really need to look all the options available with us, and based on our idea, based on the patient's financial process and financial understanding, you can think of whatever best you can recommend. So there are options which are available like daily disposable and monthly disposables. You can suggest all different options to the patient. So that's what in India, as per my where we don't have so many, or we don't have a toric multifocals, we really need to look about then monovision as the option. So, but then yes, you are going to compromise your correction to the patient. You may not be able to give a good quality vision. You are going to compromise with depth perception, and that all things would come. But if patient is really want to remove from the glasses, then yes, you can think as the one option related to that. Colors also we don't have. So if any of them wants to wear a color cosmetic multifocals, we don't have right now available in Indian market. So that these are a few things I think you should really look more. My always concern is looking speciality is a different thing. We have so much of work which is with the standard soft contact lens practice, and so many, almost everyone is going to be presbyopia in future, and that population is much higher than the specialty practice population. So I think focusing on those areas will give a lot of values to our patient. So that's a few things. Any questions you have, you can really let me know.
Yeah, sir. We have certain questions in the chat box. I'll read it up for you and you can answer for the same, sir. First question is how multifocal lenses help myopia?
A multifocal lens helps in myopia. One is there are another lenses available which is called EDOF lenses, which is mostly a new generation one. They are coming up with the center distance design, and they are working on the extended depth of focus. So that can help. The main purpose of myopia control is nothing, just the rays which are hyperopic defocus, bringing the rays onto the retina, the peripheral retinal rays which are focusing outside the retina, that's hyperopic defocus. That's the main concern which is there. So we don't go with the normal routine multifocal contact lenses. These are different designs. So basically EDOF is one which we can work in Indian scenario. Second one is center distance design. Generally more of center distance design works. And mostly in the Indian market, we have center near design. So they are more of aspheric multifocal designs. Concentric ring bifocal designs these are not much available nowadays. So only we have center near designs with aspheric design available. And yes, the new generation, which is the EDOF, is also there. So that can be there with it. But yes, you need to look at the more of clinical things. As studies suggest, multifocal soft contact lens has a good efficacy in myopia control. We can definitely try multifocal contact lenses, but that's a different, all too different thing, because you are going to deal with a whole different age group. You are not going to deal with the higher age group.
Yes, sir. So we'll go to the second question. They are asking, will universal base curve fit for all the patients?
Yeah, it definitely fits, because most of the, but now here again, you need to look all your previous findings. You look at your keratometric readings, you look at the, but if you choice it, and most of the time it fits. But yes, if you, and all the companies and all the products, they have been giving it one fit guarantee. If not, then they will take it back. So I don't think there would be a problem, unless and until your choice of selection of the patient is having a irregular and all, then definitely you will not select a multifocal contact lens. Unless and until if there is an eye which is very smaller, or if the eye is very big and you know that the diameter is not going to be in that range, then yes, we should not select it. So, but yes, most of the lenses will fit. All these lenses are very thin and very soft, and one-day disposables are also working very well with multifocals. We used to struggle, or we used to say that it takes an adaptation time, but nowadays it's not like that. You wear it and probably patients are very happy. Yeah, but one thing we should remember about it, we are not supposed to give more of very detailed things to be done. I think like patient is very demanding. I want to read 6 by 5, or say I want to read N5 or something, and they are doing a lot of almost every time, almost whole day they are doing demanding tasks. Then probably they may not be very happy some period of time. But if they are doing a normal activities and they are being used to it, then it will work very well.
Yeah, sir. The next question is, what is reverse monovision lenses?
Reverse monovision, I am not sure about it, but there is something which I heard which was modified monovision, which was something I think that could be the question here. But modified monovision, where you put one eye, which is a multifocal contact lens, another eye you put the distance dominant lens. So the patient who are been compromised with distance, who are compromised with the quality of vision, probably they would be more benefit with it, because one eye you are giving a distance correction and another eye are giving a multifocal. So their distance vision is more better, and the near vision is also better with multifocal. So that, I think that could be the answer. Exact term I am not sure about it. What could be this? But I heard about one is modified monovision.
Yes, sir. The next question is, why is pupil size so important?
So we already know that pupil is one of our gate to be entering into the light system, and it is not just about the entering into the eye, it's also going to relate with your visual processing, it is going to relate with everything in the brain. So how your pupil is reacting to the light, that gives a lot of information, and if is very much immediately dilating and they are having a lot of near activities, and the pupil is not constricting well, then they may have difficulty. When they are driving at night, and if their pupils are very, very dilated, probably then they also have more problem. So the ample amount of light they should have, and the pupil should constrict. So I think the pupil is very important, and this might go into a different area, but if we are more into this near zone stage right now, we do a lot of near activities. So our pupils are not very much normally reacting as earlier we used to have. So it's like it's not normally constricted, it constricts, it's dilate also in between, and there is accommodation, version system, everything works together. So it's a very different thing is happening nowadays. So a patient should look about this pupil. I'm not talking that pupil reaction should be very much normal or abnormal, but yes, look at the pupil size, how they are reacting. And if they have some strain stimulus more affecting on it, then yes, we should look into this aspect. Otherwise, they will have some difficulties. They may have difficulties at distance, they may have difficulties at near, or driving, or the abrasion issues, anything they might face. So patients who really concerned about the occupational demand, like I would like to drive, I would like to do certain activities, and their pupil is not proper, they may have that compromise thing. So giving glasses is an important solution. Like that's why center near design is important. They wear sunglasses in daytime. So when they go out, the pupils are dilated with the sunglasses, and that can benefit for distance vision. When they come in, they remove glasses, so the near vision is again clear with the accommodation process. So that's working very well. But I don't say that center distance design may not work, because there is a brand where one IU gives center distance design, another IU gives center near design. So different companies have different way. So if you think that that is also working, then you can try that. But I know this is not available in India as of now. One is one eye center distance, another eye center near.
Okay, next question is, cylindrical powers up to which diopters can be manufactured in multifocal lenses, sir?
Multifocals in India, it's a really difficult one. I guess I don't know where we can go with multifocals with soft contact lenses. It's not that easy. You can need to go with specialty practice of toric, RGP, and other ways. But again, multifocal is going to be extremely difficult. So we need to look at the monovision aspect. Multifocal, you can order it, but then it becomes very expensive. You need to order it from international, and then the time constraint and everything becomes very expensive. Patient doesn't get lenses on time.
Okay, sir. Next question is, what is the suitable material for multifocal contact lenses?
So material selection always depends on your patient's need, where you need to select it. I definitely won't say, if I say that everyone would say like it's a silicone hydrogel, it's not always a silicone hydrogel. You need to see how your patient is. If the patient has already been a wearer and he's been comfortable with an hydrogel material, you can give hydrogel material. That's not a problem. And considering it how the patient is wearing their earlier lenses. First time wearer, good eye health and you want to give a good eye health, yes, silicone hydrogel can be a good choice. But if the patient wants to wear a daily disposable, then you can go for a daily disposable as an hydrogel or a new technology lenses. So you can have Bio2 or any of the other lenses, one day multifocal lenses, based on the higher water content and the material mixed with it, which can help. So thinking about what their comfort level would be, how they want to wear, because a monthly disposable, definitely a thickness is going to be big there, and the material is going to be have different modulus. So we really need to look what is their need. That can be choice.
Yes, sir. The last question is, as multifocal IO will reduce its contrast sensitivity, will the multifocal contact lenses also reduce contrast, sir?
Multifocal contact lenses will difference because of their, so if you again do the study on, probably in the case of dim illumination and light illumination, you might see the contrast issues. So definitely that will affect, because there is a power progression and it's a very small lens we are looking into it. So it will change that contrast. But I really need to look at the research paper, how much contrast is decreased with it. But as of now, we can not say that much contrast is decreased, because nowadays all lenses again comes with an aberration control as well. So that helps in those area of improvement where your clarity is also improved with the night vision as well as the day vision. So contrast may not be more issue. I think people doesn't look more contrast. People look more about how they can wear lenses and how they are comfortable with the lenses. We look more detail aspect of the patient side, that how much contrast is improved. But otherwise, when they wear lenses, no one goes with the chart and they will look at. They just look at how my functions or my parties or my evening is better with the lenses. So whether they can see lights properly, whether they can see things properly, whether that is better. That's more than what the patient side.
Yes, sir. And one more question. How many patients turn up with the troubleshooting parameters, sir, with respect to multifocal lenses?
I would say proper refraction will not give any troubleshooting. So best thing is, what we can do is, if you really think about it, I always order 3 lenses together. I never order one lens. If you get trial lenses nowadays, it's a difficult one. But if you really get trial lenses, you can order 3 lenses together. Mostly challenge comes with the 50 or 50, 51, 52 age, because there your ad will not be the same. You may have to give one eye which is low eye, another eye which is a high eye. So you can order always what is their need, demand. If they are more demand in distance, you can order 2 lenses of low eye and 1 high eye, or 1 low eye and 2 high eye. So that will help you a lot, where initially itself you put lenses, take 5 minutes break and do the adaptation time. And if the patient is not happy, change 1 eye lens and see it. You can put minus 0.25 first and then you see. So generally 3 lens you can order it at the first instance. So 50 where 1 eye which is low eye, and another eye, if you are ordering low eye, you just want to change to a high eye, you can just change it and see. So mostly no troubleshooting will get if we have a very good refraction skills. I think best refraction will give you a best answer related to it. You will never get a problem with the patient, unless and until we may have not checked the other parameters, maybe a dry assessment, or we really didn't understood what they need is the patient. So as I mentioned, very demanding patients, you really need to look at, then you can think as this is one of a very good option, but not as the only option.
With respect to base curve, sir, with regarding to fit, steep or flat, will there be any complaints with multifocal lenses, sir?
All will be the same. If you are looking at soft contact lenses, toric lenses, or anything, the fitting parameters will not change. If it is steep, it is going to create indentation, and there is going to be initial comfort, and there may be a tightness issues. If it is very flat, it is going to be loose, and the patient will not be happy. So I would really think, yeah, you just look into the case. Mostly, all the lenses are not going to be very tight. But yeah, your soft 1D disposable looks very tight because of the thin modulus, and you find very thin lens. But otherwise, the fitting will be very good in every lens. So just try and see. I think that would be the best thing. But fitting will not change with designs. So if you look spherical soft, you look multifocals, you toric, the same parameters or same thing we need to apply. The complication related to fitting is the same. It will not change if you change the optical property.
Yes, sir. And thank you so much, sir. That's all with the questions. And I would like to thank you for joining us this particular session, sir. It is a great pleasure to have you with our own stage. Thank you, sir.
Thank you. Thank you so much. Thank you for this invitation from Agrawal Institute. And thank you for hosting this very well. And I would be very happy if you have any questions in later stage, we can definitely connect. And
Yeah, sir. We'll ask the students if they're having any doubts regarding the same. We'll ask them to email you with the same doubts, sir.
Thank you.
Also hoping for the next session or future any sessions with you again, sir.
Definitely. Thank you so much. Thank you. Have a nice day.
Thank you, sir.
Thank you, sir, and thank you everyone for being a part of this. I feel so happy to be a part of this wonderful session. And as we know, we'll be having best modules at the end of this week, end of every week after the Optometry series is getting over. So the best modules will be put down in the description box below. Please do check it out. And if the viewers, you have any comments or questions about this Optometry series and or about this episode, please do leave it in the comment box below, and we'll come up with the updates about that. And I thank all the YouTube and the Zoom participants for sharing your valuable time with us.